We've been preparing for CQC inspection for a number of years. We've been recruiting the right staff and putting in the right systems and processes so that we're able to offer excellent primary care to our patients. And CQC inspection has just been a part of that process.
In this practice in particular, although they were able to tell us all the things that they were doing well, they were very clear that they were ready to listen if there were any improvements that we thought they should make, and they were always trying to gather information from their patients and staff to see where improvements could be made or things they could do better.
We were naturally nervous about being inspected, keen to prove ourselves, and we also welcomed the opportunity to receive some feedback as to how well we were doing. We were delighted when we received an outstanding rating. The staff were very proud and we were pleased to be able to communicate that with all our partners.
The access to patients was particularly outstanding. Patients could telephone at any time of the day. They'd give brief details about what their issue was if they were happy to do that, and a clinician would phone them back very quickly. The clinician would phone back at a time that was suitable for them, so that if they were at work, they were able to say, I've got a lunch break between 1 and 2, could you call then? Or even later on in the evening, patients could ask for a telephone call from a clinician. And this is all feedback that we got from patients. It wasn't just information that the practice gave us. After that telephone call, if an appointment was necessary, which often it was, they were able to have an appointment on that same day, and that was whatever time of the day they phoned up. If they were to phone up late afternoon, they were still given that same day appointment. It also worked well because the practice was open late 1 day a week, but other practices within the social enterprise were open late on different days, and there was a facility, if necessary, for patients to go to those practices instead. The same happened at weekends, where they were open 1 Saturday a month, but if necessary, patients could go to one of the other practices. Another thing that stood out with this practice is the staff ethos, that everybody worked very, very well together, and there was no sense of one particular staff member was more important than another. They all worked very well as a team. They had regular meetings of the team, not just with this practice, but with the other practices in the group. And those meetings were held away from the practice, so there were no distractions. They concentrated on the issues that were important to the practice and making improvements to the surgery as well. Every single week, the Chief Executive sent an email to all staff, giving them any updates, giving them information, giving them praise where necessary, and telling them about any incidents. So staff all felt completely involved in the whole running of the practice. They said it was a very open place to work. They were encouraged to make suggestions, and as part of the weekly email they got, they were asked for any feedback and anything that they thought could make the practice work better.
As a result of the CQC inspection and the feedback we've received, we've already met with the director of the Community Health Partnerships who own the building as to ways that we can improve the reception area, and we've also started recruiting for a practice pharmacist. We know we're not perfect, and we continue to learn from mistakes and to continually improve wherever we can.